That's the funny thing about, remodeling.
It was a kind of a shell game,
Was it
Internal
family?
medicine was divided up. Family was on the first floor and the second floor.
Mm-hmm.
And we had to shuffle people around. The amazing thing is that we made room for everybody while the remodeling occurred on the second floor. And they had full access to the second floor, which reduced the remodeling cost dramatically. Instead of doing half and then trying to do the other half, it was very good.
Who does the logistics? That must have been a nightmare.
I don't know who did the logistics, but the architect was Mark. And she did a good job. There's only a few little things that probably same thing with any construction. That's the opposite of a selfie.
Yeah, that's right.
This is all
Yeah. Yeah, no, it's really nice. So the next floor eventually, but it's not going to happen for a while, will be the first floor. First floor is like the oldest part of the building. So it'll be interesting to see how it.
What you uncover
Well, they know because when they get up above the first floor, between the first and the second floor is the old roof of the original thing from way back, log cabin and stuff.
Yeah.
So it's pretty fun. Wow. I haven't been up there.
That must go way back, because I've been in this town for over 30 years.
Oh yeah, it's like 1952 type thing.
Wow.
In fact, the rooms that I see patients in are part of that original. Or when they did the lab addition, they ran log walls.
Wow, that must be interesting.
Yeah, exactly.
Well, I always think with the Affordable Care Act and all these changes, it must be such a challenge to try to keep everything.
Predict the future and try to which direction you go. Or you start going one direction and something throws a curveball at you, and you're like, okay, we better reconsider.
Yeah. Pretty darn nice. Well, good evening, everybody. I'm Robert Hannon, and for University of Alaska Fairbanks Summer Sessions, I want to welcome you to another really informative evening. I know you'll be interested. Before I introduce Dr. Capistrant, I'd like to mention there are a couple of other things taking place this week that might interest you. And considering this has to do with medicine, I'm almost hesitant to mention what's taking place tomorrow, which are novel ways of murder in Alaska. So, but that's presented by Leon Unruh, who's the editor of Alaska Native Language Center. So a whodunit tomorrow, and you'll probably be a little healthier tonight. And then on Thursday, Mark Brown and the Blues Crew performed down at the Jorgensen Botanical Gardens just down the way, and that's going to be fun too. So, a great week of events for you. I want to remind everybody who has a cell phone, please turn it off at this time, and so it doesn't cause any interruptions during the event. And let me introduce Dr. Capistrant. He's been a physician with the Tanana Valley Clinic since 2006, where he first began attending patients at the First Care Center and served there as assistant medical director. In June 2013, he was selected as the medical director of the Tanana Valley Clinic. He's a board-certified family medicine physician who specializes in osteopathic manipulation, not the emotional manipulation your kids do. Dr. Capistrant received his BS in biology at the University of Minnesota. He then went on to complete his medical degree as doctor of osteopathy at Des Moines University in Iowa. After completing his medical degree, he completed his residency in family medicine at the University of Minnesota Bethesda Family Practice. Dr. Capistrant also holds a master's degree in healthcare administration from Des Moines University in Iowa. Dr. Capistrant specializes in osteopathic manipulative medicine. I can't say that 3 times very fast for sure. And he also specializes in family medicine. He's board certified with the American Board of Family Medicine. He's one of only 3 physicians in the United States certified to teach seminars on the model, which allows for effective manipulative treatment for pulled muscles, fractures, and frozen shoulders. So, without further ado, Dr. Capistrant.
Thank you very much for the introduction. Today is mostly about not what I do all day in the clinic. Today is about complementary medicine as a wide range of healthcare options. We were joking earlier, I can spend days talking about what I do in the clinic, and I do that on a relatively regular basis. I travel teaching what I do in the clinic. But today I was asked to speak more on a general topic of complementary medicine. What does that mean, and how does it fit into the healthcare that we are all seeing in our future? I can tell you, years ago when I graduated from medical school, this would not have been a very popular topic. Even though complementary medicine was growing, it would not have gathered the momentum that it is now. Much of the information I'll present is actually from 2007. It's still kind of staggering to see some of the numbers of use of complementary medicine, and I can guarantee it's grown since these numbers that we'll be going over and showing you. It's very impressive, the use of these modalities. Sounds like we got a little bit of an echo, but so an osteopathic physician is a physician very similar to an MD that is trained in medicine, but then also in the art of manipulation. We use our hands to diagnose, treat, and prevent illness. So why am I giving this lecture? Mainly because as a person who performs manipulation as part of my practice, the assumption is made that I have an opinion on all other forms of CAM, or complementary alternative medicine, is the term that's most often used. Many people are kind of going away from the alternative term because of the implications that alternative implies, and we'll go over that in a minute. So I get asked questions a lot about other modalities that may help people achieve their health goals. And as we say here, more and more physicians are coming out of medical school and residency not so much concerned with what's standard practice in the medical world, but what's the most effective. Our whole healthcare system is changing to something that you may hear about called value-based. And so value is perceived as cost-effective and appropriate care. And there's a lot of research being done on treatment of all conditions that it doesn't matter if it's a pharmaceutical or an alternative therapy that provides the best relief, what provides the best value. And so in our clinic, we have a department of osteopathic manipulation now in Tanana Valley Clinic. We work to incorporate more and more modalities into our practice so that we can get the best results possible. So kind of a brief outline. What is complementary medicine, or CAM? What are the CAM modalities? Kind of going through use of CAM in the United States, your healthcare provider in CAM, some of the things that we get worried about as family practice physicians when you are using alternative modalities. Looking at some of the information available by the NIH, looking at a new kind of wave of training that's coming out called Integrative Medicine, and then kind of what's your role in this whole process. And then there was a great little six tips for selecting a complementary alternative medicine provider. So kind of getting a sense of who's in the room. Are there any, what they would qualify themselves as CAM providers in the room? Anybody who performs a complementary alternative service? Yeah, I got one student in the room, so I know that. Okay, so never know who's going to show up. We are in Fairbanks. We could get a whole group of people. So CAM is a diverse group of medical and healthcare systems, practices, and products that are not generally considered part of conventional medicine. So that's CAM. And it stands for Complementary Medicine, which is designated, used together with conventional medicine. So the idea of complementary is you use it with your regular health care. Alternative medicine is used in place of conventional medicine, and that's why alternative is kind of falling away from the popularity, because to seek an alternative to what's generally accepted as the health care is not where most CAM providers want to be. We want to be, and for the moment, I'll accept the role of an alternative practitioner by doing manipulation. We don't want to be seen as an alternative. We want to be seen as part of the team. If we can provide manipulative services that help you achieve your health goals, then we're really part of the team and not an alternative. It shouldn't be an either-or type situation. And then the last is integrative medicine, which is, like I said, it's a rapidly growing field. Combines conventional and CAM treatments for which there is good evidence and safety. So the biggest part of integrative medicine is having the science to back up what you're doing. So some of the CAM modalities that, when you look at the government's description of who fits into what category, one of the largest areas that we see is the natural products such as the herbs, which are also called botanicals, vitamins, minerals, probiotics, dietary supplements is another category they fall under. So we'll get into that a little bit. The mind and body practices are divided out further. Acupuncture is a very common modality that has gained significant acceptance over the last 10 years. Massage therapy, meditation and mindfulness, which is one of the most commonly used modalities. Movement therapies such as Rolfing, Pilates, relaxation techniques, spinal manipulation, Tai Chi, yoga. All of these things are, you may have additional therapies. A lot of times there are subsets off of some of these main categories, but if we look at the NIH website, these are the categories they identify. So CAM usage and costs in the U.S. Now these are a little bit number heavy in their graphs, but they're really intriguing numbers. As I was putting this together, just the overall use of alternative or complementary services in the United States is pretty astounding. So just the headline, not the details. Almost $34 billion was spent on complementary and alternative medicine, and this is 2007 data. So you know that number has gone up significantly since that time. So $34 billion. I don't know about you, but that's a really hard number to get my mind around. That's a lot of money. So I kept looking. If we look at our total healthcare spending, $2.2 trillion. That's also a really big number. So this chart shows in the marigold kind of color when you have a bill, we all know that the insurance company or some other payer is covering your cost, and then you have your portion. So the little blue and green pie piece is what most people pay out of pocket, and then the rest is covered by the system. That little tiny green wedge is what that $34 billion is. So while it's a huge number, it's still a small drop in the bucket of our total healthcare spending. If you look at this graph, off the bottom is kind of a triangle. It extends down onto this next slide. I didn't want to cram it all onto the one slide. If I did, you wouldn't have been able to see it. So a lot of information here, but just realize this is the total out-of-pocket spending. So what you and I would pay when we go to the physician. You can see right here, hopefully you can see that up there. This is physician visits. This is CAM practitioner visits. Right here, this is almost $12 billion. There's other CAM, which is broken out further, but the non-vitamin, non-mineral, natural products, and then prescription drugs. So prescription drugs is nearly $48 billion in 2007, and $15 billion for the dietary supplements. So it's a huge industry in our country. Obviously, people are using these modalities. 83 million people spent that $34 billion on CAM products and services. So it's about 11.2% of the total expense out of pocket. So what are we spending $34 billion on? I just like saying that number. It's huge. It's amazing. And that's 2007 dollars. So I can only imagine it's probably dramatically more at this time. By far the largest percentage of what we're spending it on is dietary supplements, what they label non-vitamin, non-mineral, natural products. So that's $15.4 billion. Then you see the massage therapy or massage practitioners, the movement therapies, spinal manipulation, and homeopathic medicine, all listed there. But nothing comes close to the supplements and medications that we purchase. So here's a little bit more detailed look at this. What are the CAM therapies? So the natural products again. And the percentages here are of the last 30 days, the percentage of adults who have used CAM, how many of them used what. So if you use something complementary in the last 30 days, the vast majority of people used a natural product. Some of the things that are important to think of as alternative or complementary is deep breathing, meditation, manipulation, massage, yoga, diet-based therapies, progressive relaxation therapy, guided imagery. These are all more of a meditative and mind focus. Interesting, this sidebar graph shows that over a 5-year period, 2002 to 2007, the fastest growing CAM modalities was meditation and deep breathing. So that has gained popularity. And there's good science to support that emphasis. So what conditions do people seek complementary and alternative medicine services? Back pain is by far the most common. And that's why you see a preponderance of people who are treating back pain in the clinics and workplace. Neck pain, joint pain, arthritis, other musculoskeletal, headache. I would lump all of those into my practice. However, we also have anxiety, cholesterol, and insomnia. And head and chest cold. Those are the other, round out the top 10. But by far and away, musculoskeletal pain is one of the things that complementary services are being sought, the reasons they're being sought. So when they use natural products, that vast category that far outweighs everything else, what are they using? Fish oil, which is good if you're an Alaskan fisherman, I think, is by far the number one supplement that's used. Glucosamine is used for arthritis and achy joints. Echinacea is for colds and head colds. Flax seeds is for cholesterol. And then you can see down the list, ginseng, combination herb pills is kind of a category of everything. Ginkgo, chondroitin, usually combined with glucosamine, hard to separate. Garlic supplements and coenzyme CoQ10. These are the top in 2007. Who uses these products? Basically people between the age of 30 and 70. That's the vast majority of people. I think as our population tends to age, we're going to see that curve shift to the right. But not just adults use complementary services and products. We see that children, while at a much less rate, they are also being exposed to complementary therapies. Natural products, again, takes a large number. Spinal manipulation and other forms of manipulation is the next in that category. Deep breathing and yoga has been introduced to a lot of the children, all the way through homeopathic treatments, traditional healers, massage, meditation, diet-based therapy, and relaxation techniques. The most common natural products in children are echinacea, fish oil, the combination, and the flaxseed. So you see there's echinacea has properties that make it conducive to fighting the common cold. And so a lot of kids, a lot of colds, a lot of echinacea. They also have, and that's with this 6.6%, but children's and youth suffer back and neck pain as well. So musculoskeletal pain starts at a young age and continues to progress. You'll see people are trying to alleviate stress and anxiety with complementary and alternative services. Also, ADHD and insomnia fall into the children's categories. So usually when you ask, or a perception is, when somebody is using a complementary service or an alternative resource, the perception is that people are shunning the medical profession because they're frustrated or dissatisfied with the service. And I think 20 years ago that was the perception on a lot of the physicians' part, is that somehow they were not being respected as an authority in healthcare if you used something else. You were questioning their authority. However, the true research of people who are choosing to use these medications, services, dietary supplements doesn't support that. It doesn't show that. It shows that people feel that complementary services just align better with their overall philosophy on life. They don't want to use a pharmaceutical. They want to try to address whatever issue is troubling them from a different perspective. It expands their options. And that is one of the things that the research of people who are spending $34 billion a year pans out, is that these people don't necessarily have a problem with the healthcare system other than the problems that everyone else has with the healthcare system, is that it's too expensive and all that, but that they want to have a better option, better system of options. And one of the markers of that information, which I found kind of fascinating, is 22% of people who were in that category that spent $34 billion are on no prescription medications. That means the rest are on a prescription medication. So they're not really shunning the system if they're using the prescriptions that their providers write for them. Some of them, almost 20%, are on up to 5 medications or more. So that's pretty good use of the traditional medical system. So I think we can push aside the idea that users of complementary services are people who are not interested in the traditional healthcare. So if people are using these modalities so much, we're spending this kind of money on them, why does traditional medicine hesitate to embrace them? Why is there such a barrier to anything new? That's the question. And that's what you see sometimes when you see your provider and they don't always appear receptive, or they seem a little bit skeptical to what you're using. When I was in Arizona as a medical student, we had 3 cases of chaparral tea hepatotoxicity. And I've never seen it since, because we don't have chaparral trees up here. But this was all part of a traditional healing ceremony. They had consumed the tea, and their liver shut down following the ceremonies. It was 3 separate episodes, so it wasn't like just one bad batch of chaparral tea. So those things are real. They happen. Bad side effects to regular tested medicines happen as well. But so when we look, herbal medicines carry a risk of hepatotoxicity. You can see that this is just May 1st of 2014. So this was just in one of the family practice journals that we all receive as family practice doctors once a week. So 2 of the main safety concerns for dietary supplements. Remember, almost $15 billion are spent on dietary supplements. Your doctor isn't always 100% excited that you're using these, and this is the concerns. And these are straight off the NIH website. This is their concern. So the possibility of drug interactions, that is a real concern. For example, research has shown St. John's wort interacts with drugs such as antidepressants in ways that can interfere with their intended effects. The other common thing is surgery. Many people in the room have undergone surgery. You get asked the question, what are you taking? And more they're emphasizing what herbal supplements are you taking, because many of them can prolong your bleeding time and make recovery from surgery much more difficult if they don't know that you're taking those medications. Product contamination is a very serious concern. Supplements have been found to contain hidden prescription drugs, other compounds, particularly in the diet supplements that are marketed for the weight loss, sexual health, erectile dysfunction, athletic performance, and bodybuilding. The whole category of dietary supplements is under a different regulation. And so you'll hear this as an argument from your physician all the time, that you really don't know what you're getting if you're not careful about who you buy the supplements from or where you buy them. A New York Times article out of November 5th, 2013 shows that only 2 of the products tested contained what they said they did. Which, here we spend $15 billion, and what are we spending it on? If you look at this graph, this dark gray is fillers including rice, soy, and wheat. So some of these products contain nothing of their ingredient that they were supposed to. The right side of the graph is the greenish color is what is supposed to be in the product. Left side is something else. And so in this last one on the bottom here, 50% of that product was a filler and 50% was a substitution or mislabeled ingredient. You look at the one above it, it was probably 60-40. And then this one was 100% a contaminant of authentic ingredients with other plant species. Very interesting idea that we're spending all this money because it's been shown to be beneficial, and the people who are making it and labeling it and distributing it don't even have it in the pill. And that's a little bit disturbing. Yeah, it's a little more than a little, I guess. So just to prove the point even further, herbal supplements are often not what they seem. This is from the New York Times. FDA even has a site that you can kind of try to find certain things if you're interested in taking them. But the NIH also has some good information that you can try to track down, very specific to CAM. They have the NCCAM, that's the National Center for Complementary and Alternative Medicine. They're putting a lot of effort, time, and money into researching products so that if they do have benefits, how can we get them to people and put it into our practices? So there is hope, but your healthcare providers want you to get better, but we want you to do it safely. So as a family physician, when I have a patient who comes in and they're on 5 different supplements, that doesn't bother me. What I want to make sure is that they don't interact poorly with either a medication you're on, that I want to put you on, or with each other. And that's the complicated part of some of these complementary services. This is a website. Actually, my medical student just came from the University of Arizona Andrew Weil's Integrative program. She had spent a month down there rotating. And this is a website that you can either get membership or try to search the products and come up with which ones are worth buying. So if you're going to try a product, it's like the Consumer Reports for dietary and herbal supplements. So it's a good website. It's called consumerlab.com. There's others that are similar, and no, I'm not paid by them to do anything. But I personally am excited to find this type of information because, you know, if somebody comes in and they say I should be on fish oil, my cardiologist said I should be taking fish oil. Which fish oil? Which one is good? Which one has what it says it should? Which one is pure and doesn't contain some contaminant that can hurt me? These kind of websites may be helpful in us identifying which products are good. So should improved labeling laws and restrictions. This is another May 1st, 2014 article that to me shows there's proof that somebody's actually looking at complementary health in a more significant way and combining it in some serious research. So if I read carefully, I think there was over 200 and some participants in this, 207 participants in this study that showed that if you have rheumatoid arthritis and you're on methotrexate, which is a common treatment for rheumatoid arthritis, that there's actually a Chinese herb that when they use predominantly in China for treatment of rheumatoid arthritis, the benefits, double-blinded, are essentially equal. This is new information, so it's probably not hit mainstream yet, and there's probably going to be more testing on it. The thing that was intriguing to me was it's $5 for the Chinese herb and a lot more for the methotrexate. Even though methotrexate is not a terribly expensive medication, it's got a lot of bad side effects potentially. Great medication for what we use it for, but the idea that the research is being conducted, that people are now taking herbal supplements and dietary supplements and doing research in an evidence-based way to try to come up with the best information on what can help us as patients. That gave me hope. So here's some of the research that the NIH paid for, sponsored, and was involved with in 2013. Things that you'll hear about and are often poo-pooed by the medical establishment are getting investigated. So like chelation. Chelation has not been thought to be regarded very highly in the medical field. There's often the science has not been truly supported. And you can see that they actually studied it and looked at it in diabetic patients after a heart attack. Other options are practitioners reap genetic changes after a day of mindfulness meditation. Whatever that means, I don't know. But they studied it. Spinal manipulative effects may go beyond those of placebo or expectation, study finds. Optimal number of spinal manipulations. So what is too much, what's not enough? Mind and body approaches for smoking cessation. How can these CAM modalities help with a terrible addiction that's hard to get away from? This is just a small list of some of the things that the NIH supported and funded the research. It's in my practice, I practice a manipulative style called the fascial distortion model, and as in the introduction, I'm one of 3 people who teaches that in the United States, which is the same 3 people who are trying to do the research. And actually, that's a little overstated. We're growing our group of people, and many of them are students and residents and fellow physicians. But trying to do the research to support what you're doing is an enormous undertaking. We have ultrasound, and we're trying to expand that. But when you look at a study like this, supported and funded by the NIH is a big deal, because that gives you bodies and personnel that can help do all the legwork. Most of the, you're not going to have a naturopathic physician somewhere in Fairbanks who's testing bee pollen on condition X. You may, but to get it scientifically high enough power that it would be valuable to publish and have everybody in the country now trying to change their practice style based on that result is an enormous undertaking. And that's why we see drug companies, manufacturers of pharmaceuticals, their research and development portion of their budget is absolutely enormous. Billions and billions of dollars are spent on developing a drug because of the research that goes into it. And then a whole lot is spent on the marketing trying to recoup some of that investment. I also found it very interesting that there's, and this wouldn't have happened 15 years ago, 10 years ago, maybe even 5 years ago, there's online continuing education for physicians and providers. So what we're seeing now is this rapid rise in the use of complementary services. Our knowledge as providers is lagging. Things take, and this is proven in evidence, 15 to 20 years to become mainstream medicine. You can take something that has tremendous benefit in your health and healthcare, and it takes a long time to be absorbed into our practices. And we see this as we're trying to, the family practice system and the pediatrics systems do a very good job at essentially standardizing their practitioners based on the national board exams. So for years I was hiring family physicians to work at First Care, and I knew that if I had a board-certified family practice doc, they were going to be relatively similarly trained, similar experience, similar knowledge bases. And the same thing goes for pediatricians and internists. There's a knowledge base that's possessed by this group because of the testing. Trying to expand that knowledge base, change that knowledge base. You can't take somebody who trained in medical school 20 years ago and get new information into their head quickly. The amount of reading that is required to stay current on the top 20 diagnoses in your field it's astounding. I mean, thank God it's on the internet now. Otherwise, I remember stacks of things next to your bed, that was like 2 feet tall, and it was all the current family practice journals. Now it's just on your iPad, and you're filling up your memory space. But actually making available modules that physicians can use, and if they're involved and interested, can go in and learn about, how does acupuncture affect my patient population? How do herb-drug interactions affect my patient population? What's new, what's old, what's past, what's present? What is the deep neurologic basis or neural basis of mind-body pain therapies? We all know that pain control, overuse of pain medications is a huge issue, and so there's a lot of evidence that suggests that mindfulness meditation can help reduce that. And we'll get into some of the things that limit patients engaging in these activities. So this brings me to something that's called integrative medicine. Integrative medicine, I remember sitting on a bus headed from the airport to the American Association of Osteopathy's seminar and hearing a couple of residents talking about applying for an integrative medicine residency. And I stopped and I'm like, what is integrative medicine? This was about 5 years ago. I said, I've never heard of integrative medicine. I'm like trying to figure it out. And at that time there was 2 in the country. And they were talking the pros and cons of both of the systems and which one they really wanted to go to, but there was only 3 spots at the one and like 5 at the other. So you're talking 20,000 residents a year, and we're training 5 physicians a year in integrative medicine. So obviously the supply or the demand way overcast the supply. So when you look at what is integrative medicine, there's a couple of different wheels or diagrams. This is one that shows kind of the integration between traditional medicine and then the complementary therapies. And you can see there's manipulative therapy, surgery, pharmacy, herbal, nutrition, lifestyle and behavior, mind, body, and energy medicine. So all of these things combine together to form what's called integrative medicine. Integrative medicine is a healing-oriented modality, kind of that honors the whole person, body, mind, spirit, and lifestyle, and takes into account a person's interconnections with other people, communities, and environment. Integrative medicine emphasizes the therapeutic relationship and makes use of appropriate therapies whether they're conventional or alternative. So this is a growing discipline, and what we're seeing is that there's now, I think there was 20 listed when I searched the integrative medicine residencies. There was 20 or so listed, and they often partner with family practice and primary care training. So you could be a pediatrician who also completes an integrative medicine fellowship. You could be a family practice physician or an internist. In fact, we just got a resume of a candidate in the branch of internal medicine that was board certified in integrative medicine. I think that's the first candidate I've seen in Fairbanks that has come through who has this integrative medicine training. To actually get board certified in it, it's an additional 2-year program for most places. We're going to see more and more of this. Here's that second wheel that I'm going to show. If you look, the blue or the outer ring of this is what we do as healthcare providers. So there's preventative medicine, there's conventional medicine, there's your complementary treatments, so your CAM providers. And then there's the whole pharmaceutical and supplemental medications. What this emphasizes, though, is that the center of it goes to the patient, and the patient has to be engaged and involved. So a lot of the things that we see in healthcare is that patients don't own their own processes or problems. If you look at the obesity in our country right now, that is going to drive up healthcare costs dramatically, and it's going to have a huge impact on individuals' health. And that we can't wait for a pill to fix that, because it usually ends up causing too many other problems. But the mindfulness, the working towards your own health by doing the things that can benefit you, eating better, exercising, all of these things are really personal driven and not from the outside. So I think one of the main issues in our healthcare system and why people seek CAM therapies is that they want to take control, they want to try to get back into control and be able to do some of the things. Now we saw that tiny little wedge of people who are doing that. The rest of the people are not willing to do that or have not embraced it in a way that they're taking back control of their own health care. That is probably the major problem in our healthcare system, in my opinion. So integrative medicine is reaffirming the importance of the relationship between the practitioner and the patient. It focuses on the whole person, basing conclusions on evidence, and managing the use of appropriate therapeutic approaches, healthcare professionals, and disciplines. You're going to see more and more research focusing on the evidence. Medicine, period, has become an evidence-based arena. You can't introduce something new in healthcare now without showing that there's evidence that it works. You have to prove that this pill is better than that pill, this treatment's better than that pill, before it's vastly accepted into the general population. Even with good evidence, it may take years before practitioners make changes, significant changes in their practice. Focusing on the whole person has been the whole idea of osteopathic medicine for 100 plus years. The idea that the body has a tendency to regenerate and heal itself is something that many of the complementary modalities embrace, less so traditionally in the allopathic or the MD world. The osteopathic profession believes that the body has a tendency and a desire to heal itself. So do many of the alternative, like acupuncture, massage, all of these things. And that's part of this integrative medicine look. Couple of different of the major institutions that are involved in this integrative medicine push. University of Arizona has a fellowship program, and this is actually Andrew Weil helped start this. Most people recognize him. He's the kind of the guru. He's right down here in this picture, but you can't really see him. Gray beard. That is a fellowship that you can take and pass an exam. or it's integrated into your residency program. So they've reached out and integrated in their program into residencies that are outside of their immediate area, thereby expanding that whole supply issue, trying to get more people who are interested. The nice thing also is that our students and our residents absolutely want this. They want to know, how do these things fit? They're a much more holistic group of people that we are training now than, say, 30 years ago. Much more openness. Our culture is much more open to these alternative therapies. So the students who are going through medical school right now are much more willing to embrace these ideas. University of Wisconsin, Department of Family Medicine, also has an integrative program. Both of these websites, so University of Arizona Integrative Medicine and the University of Wisconsin Family Medicine, have great resources that if you're interested in finding out about conditions that you may have or somebody in your family has, you can pull up patient education. In clinic today, we pulled up several from this University of Wisconsin site. We pulled out the anti-inflammatory diet. There's a diet that's specifically designed to be reducing inflammation in your body. And as we look at inflammation in your body, we're finding out that inflammation probably leads to a lot of the problems that people have. Not just arthritis, which is kind of an obvious inflammatory process, but some of the other inflammations. Some of the research shows that heart disease is the result of inflammation in the arteries. Research continues on that. But so there's an anti-inflammatory diet. You can go to this website, print out a 2-page handout. It says, eat more of this, eat less of that. Those are available. They're free on these websites. So University of Wisconsin Family Medicine, or you can just type University of Wisconsin Integrative Medicine and then, like arthritis or whatever. Good resources. And again, the NIH has a significant amount of information that is helpful. They have a questionnaire that they ask people to fill out and submit so that they can get this data. The 2012 data is available, but you got to go through like this whole big drawn-out process to get it sent to you. So I stuck with the 2007 data. I would suffice it to say the numbers are bigger. It's in the last 5 years, the use of complementary medicine has grown dramatically, as I can tell from my own practice. My own practice 5 years ago was 20 to 30% manipulation. I worked at First Care seeing patients. Over the last 2 years, it's about 120% of my practice is manipulation. Literally, it's more than I can handle, and we've had to recruit extensively to cover the demand. Hopefully it's because people are getting better, but also because there's a demand. So integrative medicine focuses on the person as part of the whole healthcare equation, and that person-provider interaction. Patients take an active role, and a lot of patients don't want to take an active role in their healthcare. And that may not sound logical. You're all here tonight or listening somewhere, and you're active, you're engaged, you're here. But a lot of our patients want a pill that will make them better. And I think that is what we see in the dietary supplements. If you can take a dietary supplement, it's cheaper than the prescription. I'm going to take that to try to prevent heart disease. The best thing you can do for prevention of heart disease is to walk 30 minutes a day, and it doesn't cost anything. So if you can get out and walk 30 minutes a day, you're doing way more for your health than spending any money on a medication. There was one study that showed that a cholesterol-lowering drug compared to walking, the walkers did better than the cholesterol-lowering drug. And it's fascinating how pill-focused we are. What is the state saying? Better living through chemistry, right? I think they were talking mostly about plastic, but we want that pill that will fix us, no matter what the condition is. And that's the whole idea that in the integrative medicine, it's not a passive process. Patient is actively involved and needs to participate. So this is something that I give my patients on a routine basis, and they'll tell you that it's very true. I harp on the walking every day, and the studies show that 30 minutes a day is about all you need. Doesn't matter the intensity. You don't have to run. It's amazing to me how many people think they have to start running. Even the people who hate running try to start running, which is honestly really good for my business, because people who don't want to run and shouldn't be running hurt themselves, and then we get to see them. You should have an annual checkup with your provider, and you should bring your list of alternative medicine, complementary medicine, and things that you're using. You should drink plenty of water. This is by far and away one of the major drawbacks of our society. We need to drink more water, less other stuff, less soda, less juice, less everything but water. Interesting, I just saw an article on NutraSweet and horrible things associated with the aspartame or whatever it's called. And it scared me just reading the headline. And I still think it's addictive, because I had a Diet Coke addiction for a while, I admit it. It was hard to get away from that. We can eat healthy by focusing on the fruits and vegetables and the anti-inflammatory diet. How many people have been told and have heard eat better? And people don't know that already. Of course they know that. This isn't a news flash. But our diet alone can actually significantly improve our health outcomes. So by choosing healthier foods and getting away from some of the foods that we have grown accustomed to, such as fast foods, fried foods in this country, is important for our long-term health. For my patients, I tell them to walk, drink more water, and keep moving. Sedentary is bad. That's the bottom line for my practice in getting patients out there and moving. If you can move and be active, whether you're a desk worker or you sit in an airplane for long periods of time, if you can get up and move once every 30 minutes, your need to see people for your musculoskeletal pain decreases. We're here at the university. I have a fair number of people who come from the university. We've started to see the increasing demand for stand-up desks because they don't want to be sitting down all the time. They feel better if they're up, moving around, using their muscles. It's much more beneficial to be standing, moving, stop your computer, get up, do a loop around the office, come back. You don't have to take a half an hour break every time you stand up from your desk. You can go to the bathroom, you can get a drink of water, which covers two of my pet peeves, but just keep moving. I know from personal experience on the long flight to Seattle, inevitably I start to get sore and pain before we hit Seattle, so I usually try to grab an aisle seat so I can be up and moving about halfway through. One of the things is to practice mindfulness and meditation. This is not something that I, as a physician, am qualified to talk about, but I have seen the research, and I just reviewed an article recently that showed a 40% improvement in your blood pressure with just mindfulness and meditation. So 40% is better than most blood pressure drugs can get you. So if you actually will engage in some of the meditation techniques, you will see a dramatic improvement in stress levels. Stress leads to brain chemicals, which causes problems throughout your health system. So your arteries and everything else. I know we have meditation classes available at the hospital, and there's many others through town. We're lucky to be in Fairbanks because Fairbanks is kind of a unique place. You look around Fairbanks, and there's a lot of very skilled practitioners in camp. We have massage therapists, we have yoga, we have Pilates, we have Rolfing, we have Tai Chi. We have all of these things that we should be able to access without having to leave our community. That is not as easily attained in some of the other communities. So here's my harping on walking. So health impact of active transport scenarios. That sounds like some scientist came up with this. Active transport means you're applying the power, so biking or walking. So if you walk, and I've seen the same statistics just for walking 30 minutes a day, 16 to 15% reduction in cardiovascular disease. So diabetes, 16 to 15% in reduction in the development of diabetes, but walking every day can also help you control your diabetes. 2 to 6% decrease in dementia, depression is the same. Just walking can help reduce your risk of breast and colon cancer. Two of the leading cancers in our culture that drive the cost of health care and all the morbidity and problems that we have can be improved just by walking 30 minutes every day. I always joke with my patients that I think we could reduce the cost of health care if everybody had to walk to work and drink a glass of water when they got there. Because, I mean, this is crazy. Now, the unfortunate thing is it does increase your risk of road traffic crashes.
Oh, the walkers cause
The walkers and the bike, I think. I think it's probably more the bikes. I think walkers are easier to miss. All right. Yeah, we don't want to get into the bike conversation in Fairbanks. That can get ugly. So other benefits, I'm not going to read them all to you. Doesn't require special equipment. You don't have to go buy shoes. You don't have to buy a bicycle. You don't have to have, fancy places to do it. You can just walk. Big Dipper is a great opportunity for people to do loops around in the winter. I have a lot of patients who do that. It's low impact. Now, not everybody can walk a prolonged distance, so we can alternate some other activity. I have patients who use the stationary, it's basically a set of bicycle wheels, or bicycle pedals that they just turn, a little bit of resistance, and they're just getting some motion, and they can get some movement that way. Walking helps with your bones. It'll improve your cardiovascular strength, your aerobic fitness, increases your lean muscle mass. I like number 18, which says you don't have to pay for it. We pay for enough, we don't have to pay for that. So this is the 6 things you should know for a complementary health practitioner. Doesn't matter who you're seeing, what you want to see them for. I thought this was a very good takeaway about with the opportunities we have. We also want to make sure those opportunities are quality, just like in the health supplements. So you can ask your physician or your practitioner, your healthcare provider, who would they recommend? That's a good option. And I know for my clinic, that means I just set a requirement for myself or one of my students to put together a list of the people in town that I can hand patients. Because I get asked all the time, would you recommend someone for whatever the condition? Find out about as much as you can about any of the practitioners, including their education, training, license, certifications. Easy to do on the internet. I think you can pick that information up pretty routinely. Most of the, trying to think of the right word, most of the credentialed or appropriate facilities will have, online access to this is our providers and this is their training and this is what they do. You also want to find out if people are willing to work on you as a patient based on your underlying health condition. And this particular one says also willing to work with your provider. You don't want to, in my opinion, you don't want to fall into an alternative category. You don't ever want to be in a situation where your complementary provider doesn't want to interact with your regular physicians, because that will broaden the gap. You will get into a position where you don't have the opportunity of them collaborating and working together. You want to make sure that not only is your complementary provider willing to work with your physician, but vice versa. And so you address those issues and you talk openly about it. And there are enough physicians in the community, in all communities, that are willing to work with your complementary provider. Now, it may be hard for them to openly and honestly say, I don't know, because a lot of this information is new and they may not have all of the information, so they may have to do some research. This fourth one is the conditions. I know for manipulation services, there are a fair number of people who don't want to manipulate pregnant women, as an example. Libby can attest to my last 2 days. I think we saw 6 or 7 pregnant people. It's part of my practice. I'm willing to do it. I enjoy doing it. I think they're the most deserving people of manipulation. Their bodies are going through a lot. But there are people who do manipulation who don't want to work on pregnant people. Other people that you may consider are people who are post-mastectomy. They're for musculoskeletal treatments, whether it's massage, acupuncture, or manipulation. People may not want to work on that. It's their comfort zone and it's where they fit. Also, very important is never assume that your insurance company will pay for these services. Now, the good news is in the last probably 3 years, I've noticed significant improvement in the coverage of massage, acupuncture, those things. Unfortunately, I don't see many insurance companies paying for yoga or Pilates. I personally think that if everybody did Pilates, we'd be a way happier and healthier nation. It's a very good, yoga and Pilates are a very good way of maintaining your body's movement and function. Nobody's paying for it though. You have to pay for that out of your pocket. Good news is there's a lot of lower cost alternatives and it doesn't cost as much as some of the supplements. Probably the most important thing is tell your healthcare providers all that you're doing. Don't keep it hidden. You don't want to get into a situation where they find out you're on a medication or you're doing something that could be detrimental. You want to tell your eye doctor that you're using an inversion table because if you have glaucoma or other eye problems, that can cause problems. So you don't want to hide that or neglect to tell them. You want everybody to know what's going on in your health. So subtle things like I take fish oil. A good example is beta-carotene was a supplement that was touted years ago. Just everybody should be taking beta-carotene. Everybody should be doing it. Well, what we found out is that if you were a smoker, you were much more likely to get lung cancer. And so if we have that information, especially in today's day and age with electronic medical records, if something catastrophic like that comes out, I bet I got a guy who can build the program, who can find out who is on beta-carotene in our clinic, and they will give me a list of people to call and say, stop taking the beta-carotene. Another one is the vitamin E. Vitamin E has been seen to be, is very highly regarded as very beneficial, really good thing to use. You don't want to use too much is what the evidence is starting to show now. So 1, 2, 400 IUs a day is about all you need. You don't need to take mega doses. So again, just realizing that the pharmaceuticals and supplements, the preventative medicine and the conventional and the alternative practitioners, the people outside of you are a small part of what you can do. You can do a lot for your own health by staying active, drinking a lot of water, and keep moving. And the one thing I want to remember, because it always gets under my skin a little bit, when people consider you alternative, that means you're using non-mainstream approach in place of conventional medicine. Complementary means the services are part of the healthcare process and part of the team. So you're using them you're using whatever service in conjunction with the whole system.
You want to take some questions?
Yeah, so I can take questions. Like I said, I didn't specifically get into what I do all day long, but I'm happy to take questions. She said we usually take a break right now, so if people wanted to leave and kind of
So if people have places to be or have another event they want to, feel free to leave, and then we'll entertain some questions after that.
Yes.
Wouldn't this alternative medicine take a long time? And now you go to a doctor and you get about 20 minutes, 15 to 20 minutes. How in the world are you going to treat even more people that are coming into the healthcare if you go into this alternative medicine?
So the question is how the time involved. How are we going to get into that? And I think that's going to fall into the category of the value versus volume model that we're seeing pushed in healthcare right now. There's a huge push in healthcare reform that we need to get away from the physician-patient interaction as a volume business and more of what's the value you're getting out of it. So that I and my colleagues as providers, if we spend 30 minutes with you, but the value towards your health, towards your decreased utilization of dollars over your life is better, we'll get somehow compensated instead of just the throughput. So that's a good question, good comment, but that's where our system is going. I just came back from Phoenix with part of Banner Health and their leadership, and that's where the whole country is moving, is trying to figure out how do you compensate a system that for the last umpteen years has been volume driven, and how do you get them to focus on value without the wheels coming off the whole project. But that's a very good point.
Yeah, I mean, you're really, the terminology you'd like to use is complementary more than alternative.
Yeah.
Right?
Yep. Yeah, and it's, I think it's a synonymous change. It's just a subtle mind shift. Is because we know you want to continue to see your cardiologist and see your family doctor and see your whoever, your pediatrician, your dialysis doctor, but you may be using some complementary services. Yes?
This was very comprehensive and diverse. Is there any potential of getting this PowerPoint presentation?
Yeah, it's all of the information I got was off mostly the NIH site, and I'm happy to provide it to whoever.
And also by next week, this is being videotaped and it'll be available online for UAF summer sessions.
So, and we can see how they can get you the online.
I'd be happy to make just like a Microsoft Word document of like the links that were in here, like the UW Integrative Medicine website in Arizona, and send that so you guys have just the links to it.
What did you say?
I'd be happy to make a Word document that has the links that he talked about in there with the different resources. I can make a sheet of that to print it or send it.
I was thinking more of just this PowerPoint, and I could kind of expand my horizons from there.
Yeah, so we can. The question for the audience is how to get the PowerPoint. We'll try to figure that out. Any other questions? Yes.
Is Dr. Weil still practicing, or is he dead?
Yes. No, he's still practicing.
She met him last week. I hope he didn't die.
We just spent a month with him in Arizona, and he's still alive, well, and practicing.
Yeah.
72 years young.
Andrew Weil. I should pull it up. I bet I can. You guys will all recognize him once you see the picture.
Probably like 17.
Yeah, he's written a lot. He's probably one of the most influential people in this. How do you spell it? W-E-I-L.
W-E-I-L.
Is it not going to?
You're in the university service.
Oh, I am. Yeah. Here, we'll go to Google. See if I can do the technology. Any other questions while I'm looking for this?
Well, I had a question about, you were mentioning how physicians, just to keep up with the literature in their fields, when you're trying to work with another provider in an alternative thing, and you're trying to do the collaborative thing, what evidence will your primary care physician trust in order to agree to that collaborative?
So in general, the better quality evidence, and quality is based on the type of research that's done. Larger studies, double-blinded, those type of things are much more accepted as quality and as effective. Peer-reviewed journals, things that things that they can read, digest, and or have. A lot of our organizations have either family practice or pediatrics have kind of like they call it the journal watch or these summaries, because there's so much information coming out, and in a paragraph they'll tell you what this study was about and what it suggested. And probably every week you get 30 of those. And so if you just try to imagine, I haven't done regular family practice for probably 18 months, and I can bet you there's 2 or 3 new blood pressure medications that I've never heard of. And that's just 18 months. The good news is for our board exams, they don't test you on the last, 6 months. They get you the theory, broad categories, because they know that changing drugs are so common. Question? Yeah.
Okay, I had an experience where I went to an orthopedic and he said, the only thing you can do for your problem is to cut. And that's their probably most of the surgeon's philosophy. But I didn't go that route. I had acupuncture and stuff, and how do you know that it worked?
So,
And I had to pay for it, of course.
you had to pay for it. Did you get relief?
Yes, it worked, and I never had to have any surgery. And if you can avoid surgery,
So a lot of what you'll get is if you go to an acupuncturist, they think they can fix many things with acupuncture. If you go to an orthopedist, they have a philosophy and a way of they work. If you come to me as a person who does manipulation, the first thing I'm going to reach in and grab in my toolbox is manipulation. So everybody's got a different mindset and a different. When I present in the manipulation model I use the Nicolas Cage was in a movie and he had the glasses and they changed the perspective. So you put a colored lens in front and you look at the Declaration of Independence was in the movie, and suddenly this map appeared. And so what I say is every new modality that a provider can adapt into their brain gives you the ability to look at things as a different perspective. So when you see any particular specialty, their specialty is what they're going to look at you with first. You're always entitled to get another opinion. You're always entitled to try things. Now, you may get vehement opposition if they fear that it could make you, worse or unhealthy. But for most orthopedic cases, they're going to say, fine, get another opinion, try some other things, and if you don't improve, I'm here. Their orthopedic emergencies are pretty obvious. You're going to need surgery or you're not. You fall and you break something and you need surgery. The orthopedic world, they do a very good job at taking care of the things they do, but there are other ways to address pain, and you may decide that you don't need to completely new something, you may need just a decrease in the pain. So acupuncture works great, massage works great, some forms of manipulation can be very helpful, but definitely orthopedics has very good success in the things it treats, but yeah, you're always entitled to try other things.
Early in your talk, you were describing like a worldview of an osteopath.
Mm-hmm.
It sounded like a lot like chiropractic, and I was wondering, are the manipulations similar, or how are you saying that?
So the manipulation, so we'll get on a little tangent here. Chiropractic and osteopathic are classified according to this, under a manipulation category. And I can more speak to the osteopath because I'm not a chiropractor. Chiropractic is spinal manipulation focused. That is the center of their training, to my understanding. And so the chiropractic world feels that the spine is the center of everything and that's the most important. The osteopathic world, the body is the most important and the whole. So the whole body. We deal with soft tissue. In fact, most of my practice, while I do some of the chiropractic type adjustments, a lot of my practice is focused on the soft tissue and reducing the tension within the body. So while some of the techniques are similar, you're actually approaching it from a different point of view. So it's similar to the conversation we just had here, is I look at the body differently than a chiropractor looks at a body, and therefore we see different things. And so, but some of the treatments are very similar. And so patients of mine who see a chiropractor on a regular basis, they're like, yeah, my chiropractor does this. But much of what I do is very different and painful at times. Yes?
While you were talking, I just went online and I looked at the Cochrane summaries, and it's a service that tries to look at the evidence, the quality of the evidence, the quality of the studies, and I don't know if it's good for all of this complementary type medicine, but I just found one that's acupuncture for fibromyalgia. So it looks particularly at what's the evidence that this particular modality works.
Right.
And so here's kind of a complementary one, and then of course they do a
Cochrane Reviews is the reference he's pulling up, and that's one of the peer-reviewed journal kind of digesters. They look at everything, and not only journals, but they combine studies and try to find out what's the most powerful. Physicians know Cochrane Review is a pretty powerful. If you can say, I have this Cochrane Review that says acupuncture is going to help my fibromyalgia, you won't get much argument from a physician that says, okay, I'll write you that referral. Cochrane Review is a very good source, I would say, as a physician. I I wouldn't argue it. So, yeah. But there's a lot of information and data out there that you can provide so your providers or just so you can find it yourself and make good informed choices. Any other questions?
I would love to know which were the two companies.
So would I. I looked
They
for
don't
it.
tell you, but-
They didn't tell us.
The Consumer Lab website actually
They'll have
goes through each brand. Some of them are free, so the most popular supplements are free. And otherwise you have to pay for a subscription for some of the more detailed ones, but like fish oil and things they have.
Yeah, so the comment is on the Consumer Lab, and which are the two companies that had nothing in it. They didn't put that in the New England Journal article, but the Consumer Lab does have some of that website does have some of the supplements that are listed, the most common ones that you can go through and try to find, is this the right fish oil or is that? It may be a little bit more involved than just walking down the aisle at the store and grabbing the first or cheapest or largest bottle of supplement. Yes?
What are your thoughts on the difference between flaxseed oil and fish oil?
That's,
My answer, fish oil is more absorbable. It's the form that our body absorbs best. Versus plants, it takes another step for our body to digest. So for most people, eating 2 to 3 servings of fish a week is great, but I'm from Iowa, we don't eat 2 to 3 servings of fish a week because we're landlocked. So fish oil is better absorbed by your body and you get a higher concentration of it, versus flaxseed, it takes more for your body to make it. So it's not as good as fish oil, but for those who don't eat any animal products, flax is a good alternative as well as walnuts and things like that.
one of the interesting things that Dr. Weil will talk about in a lot of his writing is that, again, here we go on the better living through chemistry. So I can extract some oil from a plant, and I can get that oil, and I can put it in my body. So why bother eating the plant? And what he'll talk about is there's 25 other things in that plant that may actually be giving you benefit. So supplementation doesn't necessarily need to replace or become a big part if you're eating a healthy diet. If you're eating broccoli and kale and flaxseed and fish and good healthy food, the supplements, purifying it down to a pill that we can take because we're lazy is not going to help the problem. If you can eat a better diet and you can eat a broader range of things, that's probably as effective as taking a supplement.
And it doesn't guarantee that you absorb it.
Right.
It may be those 25 other things facilitate it.
Right, and not only absorption from those other things, but the impact, the effectiveness. A good example in one of his books was they purified out pain medication, and I think it was cocaine. They purified it all the way down, and now they have cocaine. Great, now we have cocaine, which they thought was going to be this great pain reliever. And we really don't use it in medicine, but it's heavily used in recreational form. So they took this coca plant that many indigenous cultures use and have benefit from, but cocaine was only one product out of this whole thing. And you don't usually have bad side effects from chewing the coca leaves that that people were using indigenously. Yes?
I think the real point on the Consumer Lab thing was that most of the supplements
Didn't have.
Are not what they say they are, and other things I've read indicate that it isn't just that in general they don't contain what they say they do, but there's very little quality control or consistency. So if you get a bottle of supplements, some of the pills may have very little ingredients, some may have a high concentration.
Right.
So the big problem is the whole industry is unregulated, and you're likely being taken for a ride, or you certainly are not getting
Quality, yeah. And for the camera, the comment was that you're not necessarily getting what you're supposed to in the supplements. And, I think that's why things like this that say, X brand is been tested over and over and it's shown to be effective. I think as consumers, if we're spending $15 billion, we may want to do a little bit of research and try to figure it out. If you had a car that was falling apart or was dangerous, we immediately hear about it because the industry is so regulated and so under the gun. There's no reason that we can't do that with the supplements. You know, you're putting this stuff into your body, you should be able to find good information on what's in there. And I think websites like that one and the others that are out should be very helpful at getting that. Yes?
Is there a move to getting more regulation of these supplements?
That's not my area of expertise. I would assume yes. I would assume just like everything else, there's an amazing amount of money and lobbying involved. And so until the lobby falls to the correct side, I would assume there's going to be some resistance to more regulation. You know, as I was looking at the numbers, I remembered back to my medical school days where one of the internists had just bought a supplement company, and he was an internal medicine physician, and he just bought this supplement company, and his partners freaked out that he was selling these supplements out of the clinic because obviously it's a huge moneymaker, huge revenue thing, and they could not ethically get behind him selling these supplements, partly because of the concerns that how do you prove they're what they are, how do you prove they have benefit, how do you prove their quality and their effectiveness. And so they actually basically, while I was there rotating, encouraged him, if that was the way he was going to go, that he needed to move that out of their practice because they were so focused on that. I think you hit one of the main arguments in healthcare is that concern that our patients are willing to hang their hat on this supplement that is a dietary supplement that has very little regulation, and sometimes they'll shun traditional medication. That's the argument people fear and think about. And, again, some of the research doesn't show that to be as true, but I think that's the logical one that we can all, as a provider and as a patient, say, yeah, I get that. Yes?
Well, speaking of the fish oil, my doctor prescribed I take Loveza, which is this fish oil.
Mm-hmm.
And now, you know, I was just reading more about it, and it's made in Norway. And I go, oh, that's good. And then I got to thinking about it. Norway, they do the fish farming, the salmon farming. And what are those salmon fed? No one really, you know.
This is what I would call an educated consumer. So there is a prescription grade fish oil that your provider can prescribe. It's called Loveza. I don't remember the generic name. I apologize. Too complicated to remember that. It is supposed to be very high quality fish oil. And her statement was, it's made in Norway. How do we know that the quality of the fish giving the fish oil? I guarantee it isn't as good as Alaska.
Actually, that's true. Wild Alaskan salmon have about 150 times more omega-3 content than farm salmon.
Any of your farm salmon. So basically, if you eat salmon 3 times a week, you don't need to take a fish oil supplement. Verify that with your doctor. But I mean, honestly, in our house, we eat fish twice a week just because of that. I don't need to take a supplement because that big fat layer in there tastes good and it's good for you. Any other questions? Good. Thank you.
There's some sheets out there if you want to be notified of events and upcoming discussions and lectures. There's a sheet out there to put your email address down. You'll be notified.
Thank you.
It's a lot of information.
Yeah, it was hard to condense into an hour.
Yeah,
it's a 2-year fellowship. Yeah. Green tea has some benefits that they really have touted, but I would say you don't want to overdo it. You want to, majority would be water. Green tea would be your next alternative. So, maybe a third of what you consume in a day. Still need water. It's the most rapidly absorbed. Cochrane review. Yep.
And I'm just curious.
They may, but this lab, consumer lab, that's the one that does the supplements, and there's several websites like that will do that. You know, so you.
When I first met you, I shared with you
They may. I remember that. Right, and that's the kind of thing that's really hard to get into science because they need to have broader acceptance in their research, and that's the. I'm trying to remember the name of it. Max. Yeah, I have it on my desk. It's on my list of. It's on top of the stack. Then the question is, and I haven't had a chance to look at it, but what is the science? So a lot of our science, like I can do research on my manipulation I do, and I can put an ultrasound on you, and I can squish something on, and then I can put that ultrasound back. That's not double, but so this is what they do, is they analyze, and they break it down into, is it peer reviewed, is it double blinded, is the sample size big enough, and it was, I went to a conference in Anchorage, I think it was 2 years ago, and it was just how to read a paper. And what they found, and what they showed us, is even the New England Journal of Medicine, about 80% of the research in there, and they're like, yeah, so here you got New England Journal of Medicine. It's in the journal? No, so we sat there and we ripped apart these papers and showed that, look, they're saying this, here's where it's not effective research. Okay, go to the next article. Here. And their sample size is 5 people or whatever. And it was actually depressing. We actually did it with the Alaskan legislators. We got together in a room and we heard about this, how to digest research. I still don't understand. It was the Alaska Health Commission. I don't know how I got invited, and I don't know why the legislators were there, but thanks. Thanks for the softball, too.
Well, just very interesting. Thank you.
Yeah, good. Good to see you again. I'm glad you're in with Dr. Chernick. I love her. I'm so glad she's here.
We absolutely
Yeah, I've got another one coming. Dr. Carey, she was a Van Humison originally. She'll be coming. She'll be spending her last 2 months as a resident with me, and then she'll be joining us.
nobody can be as wonderful, compassionate, and fun, and yet give you so much pain, and you still come back to her.
We hear a lot of that. Yeah.
We just love her.
Good, I'm glad.
The resume, you referenced your resume. Did you respond when you were talking?
Had an Integrative Medicine fellowship.
Yeah.
Yeah, he was a diabetologist. So the only problem with diabetology is he only does diabetes, whereas an endocrinologist will deal with diabetes, thyroid, everything. This town needs an endocrinologist because we need not only somebody who will treat your diabetes, but also somebody who will deal with your pancreas and your thyroid and all the other hormones in your body. I like the resume, but it was like that's way
It
too
just kind of
narrow
piqued my
for.
interest in just whether he would fit in or not.
Yeah. So I think what's going to end up happening is more and more family practitioners are going to, because honestly, family practice is kind of a brutal field because it's so broad, so vast, so you're like a production worker, and it just is a frustrating position to be in. And so what happens is people start looking for alternatives. Dr. Chernick has talked about taking that fellowship. I have talked about doing that fellowship. They all joke and say I should teach at the fellowship because I taught Dr. Chernick how to hurt you.
Yes.
That was she honestly didn't know that a year ago. She had never learned that technique. The thing that I love is she came with a wonderful set of osteopathic skills and a wonderful personality that you can't teach.
And an open mind.
Yeah, so she came And I said, you need to learn this, because if you're going to help me take care of the people who need to, this is the thing that makes the difference. And she's like, okay. And Dr. Wright is another one who she helped recruit. Once you learn that modality and you adapt it into the osteopathic toolkit, it just explodes what you can do for people. And the fact that it hurts, most people get over. There's a few people that
She
still
has
hate me.
done wonders for my movement on my knee. And
There's still people who, you know, it hurts to do, and they're
It
like,
does.
you're gonna. I'm probably on the blacklist of 7 people. And it's hard because 90+% of my patients say that it helps them and it's made a big difference. And then you got the 5 to 10%. Well, and it's a horrible feeling. You know, and it seems like they all come in on the same day, and they'll tell you, you know, this is sucks and I hurt and it's no good, and you're just,
It's so funny.
you feel about this big, and then next day you'll have somebody who says, thank God you did this, because I was ready to have surgery or something, and then you, oh thank God, there is hope.
She and I have talked a lot. Because I have shoulder replacement, and
it's great. I'm glad.
first of all, surgeon Dr. Wade has always been totally amazed.
I walk out the front door and these things.
I remember that because of the
Because of
medication.
I had virtually no inflammation, and so I was able to do the things. Plus, my healing was dramatic.
Right.
And they smell great.
But I still, in fact, you were the one that identified why I was pinching.
Right there.
I commented to you, I was going to go see Dr. Wade because I was pinching, and you went, no.
Well,
He
because I
can't
know what
fix
it
that.
will do.
I can fix it. And so I was explaining that to her, and she goes, oh, well, now tell me what that is again, and I'll talk to him. So I explained what you had there, and then we talked about my hip, which was the first time
No, I
anybody
understand what
had
you're saying.
identified my hip
There's
would
a
feel
reason
painful
for
at
it.
times. And I said, but I don't think I can handle that one today. She goes, why? And I said, because when he did it, he said it was going to feel like a gunshot wound, which I had never had. And after he did it, I knew I never wanted to have it.
I want you to be fully informed.
I said, that was really bad.
There's an emotional burden with treating. My favorite was a patient who came in and she said, yeah, it's been hurting about 4 months. I'm like, well, why didn't you come in sooner? I expected the old, well, I couldn't get in to see you. She says, are you kidding? I had to go through the whole stages of making an appointment with you, just like the Kubler-Ross stages of making an FDM appointment. There's denial, then there's acceptance, then there's anger. I laughed so hard because I do it. My back hurts. It's like, yeah, I won't go see anybody for a few days.
She was funny. We went in the last time, and we were sitting there talking, and Roger, I just went to the bathroom or something, and we were chatting. And she was like, oh, this has just been one of those days.
Not
And
ever like.
I forget what she said, and I said, you know, I know this really good treatment. Sit down and I'll show you. And she says, okay. And she sat down, and I started working on her shoulders, and she goes, oh my God, that feels so good.
That's funny. I better log out of this.
What does Charlie Steiner think of all this?
Charlie's funny because when the way I grew at TBC is I just kept going and giving a conference, and I just kept seeing patients, and when it worked, I'd say, well, go tell them it worked, you know, and I figure your patient, they're not going to listen to me. I'm the guy who's there all the time. I'm the last one, and now that I'm medical director, I'm the absolute last one they're going to listen to. And so what I did with Charlie and those guys is I just went and I said, this is the model. It's painfully simple, it's not super complicated, and it works. So here it is. And then I just did that lunchtime, whatever, several times. And then Charlie called me when I was working at First Care, and he says, I got a patient, show me that stuff you're talking about. And I was like, all right. So I run across the street, and I treat the patient right in front of him, and I do it. And about the third time, he's like, my God, it works. And I was like, okay. And the big thing with the physicians is many of them won't use it because they're cerebral and they don't want to use their hands. But Charlie's a perfect example of I don't care. Just refer them to somebody who will. Hi.
Pierre Johnson.
Yeah.
How are you? Nice to meet you.
Nice to meet you. Thank you. So yeah,
Nice talk.
Good.
Very well done.
Thank you.
Really down to earth and
No,
approachable.
I know you guys have naturopath over
I
here
have
now.
two, but
Yeah,
I'm
yeah.
from
Yeah, I had a mutual
Okay.
patient
Lovely.
who
Yeah.
saw her.
Nice,
Yeah,
thanks.
so that's very cool.
Great, yeah, for about,
Oh, so I
yeah, she's turned out really well. That's Kimberly Sweezy. I hired
Right.
her about a year and a half ago.
Yeah.
And, she did a GI fellowship at Yale University. Worked with MDs over there, so she's so evidence-based and
That's very
it's,
cool.
oh, it's great. She's been a real learning experience for me because she's got all her
Nah, that's good to know because I've got a gal who
Can't remember
has some
anything else.
serious